Abstract. Objective. To compare the prevalence of urinary incontinence, UI, before and during the COVID-19 quarantine in CrossFit women and their relationship with training level. Methods. A cross-sectional study was performed among 197 women practicing CrossFit. The inclusion criteria were nulliparous women, between 18 and 45 years old, who had trained, before quarantine, in accredited gyms. The exclusion criteria were not following the COVID-19 prevention protocols and having UI on other occasions than just sport. An online questionnaire was emailed containing questions about frequency, duration, and intensity of training and data related to the COVID-19 pandemic. The participants were invited to answer whether they were infected with COVID-19 and what treatment/recommendation they have followed. Whether UI stopped among participants, they were asked about the possible reasons why this happened. The training intensity was categorized as the same, decreased, or increased. Results. The mean age of the participants was 32 years old and most, 98.5%, could practice CrossFit during the pandemic. There was a decrease in training intensity in 64% of the respondents. Exercises with their own body weight, such as air squat, 98.2%, were the most performed. Urinary incontinence was reported by 32% of the participants before the COVID-19 pandemic, and by only 14% of them during the pandemic. Odds ratio, or, equals 0.32, 0.19 to 0.53, p less than 0.01, univariate analysis. Practitioners reported that the reason possibly related to UI improvement was the reduction of training intensity and not performing double under exercise. Conclusion. The reduction in the intensity of CrossFit training during the COVID-19 quarantine decreased the prevalence of UI among female athletes. Keywords. CrossFit, cross-sectional study, urinary incontinence, COVID-19, quarantine.